analytics tools. And we are very much looking forward as well for your feedback, as well as any questions and remarks that you may have. So we encourage you to please participate actively within the chat and raise your hand if you have any questions, which we will very much like to address during our Q&A session at the end of Professor Baraklow's presentation. Before we begin, I will now ask you all to participate in a poll that we would like to run before we begin our presentation in order to be able to get to know you a little bit better, where your backgrounds are from, your areas of interest, as well as your thematic orientations in regards to this webinar and what you would like to get out of it. So please, I'm going to launch a poll right now based off of your background that you can answer. And I would please encourage you to actively participate as much as you can. I have just started the poll. We will run this for about 1 to 2 minutes before we begin. And I will also use this time to run through some quick housekeeping rules that we would like you to follow during the remainder of this webinar. Please ensure that you keep your microphones muted during the remainder of the presentation, as well as keep your cameras off. And remember to actively use the chat, the written chat, as well as the raise your hand function at the end of the session when we have the Q&A. This is to ensure that we have, adequate time to answer everyone's questions. So thank you already for answering some of the questions here in the poll. I see that we have a wide variety, actually, of participants from within Switzerland, within Asia and the Middle East, as well as some from Europe. In terms of academic background, it's very nice to see that people are very much interested in digital health, masters related to pharmaceutical management, as well as public health, and a very wide range of experiences as well within national government, NGOs, the private sector, academia, and research. So thank you very much for actively participating in this poll. We will use all of this information as well in the future as we continue to develop webinars for you. So I will keep this open for about 10 to 20 more seconds. So please, if you can actively participate before we end this poll and we proceed with Professor Baraklow's presentation for today's webinar. Very good. So thank you again for your active participation in these polls. We will have another one, as I mentioned, at the end of today's webinar session. And please do not hesitate, as I said before, to actively write and participate in the chat. So I will end this poll now. Thank you very much. And now I will proceed with a short introduction of Professor Baraklow. Professor Baraklow has over 30 years of experience working in major international funding institutions and bilateral donors in medical procurement. He is currently at Empower School of Health as a professor of public health and a director for training. He has provided support in vaccine programs across Asia, Africa, and various other parts of the world. And his key focus areas include effective management of pharmaceutical vaccines and other medical commodities, especially in the implementation of programs for the introduction of new medicines. So, Professor Baraklow, thank you very much for joining us today. We very much look forward to your informative session, and I will pass over the floor to you.
Thank you. Let me just, okay. Okay, so greetings and welcome to everyone. I'm afraid today I'm going to be talking rather fast, but we have two parts to the webinar. First, I want to talk about where is the data for around 20 minutes, and then we have a short Q&A session around that, and a second presentation around the tools for data analytics. and again, a short Q&A session after that. It will be rather intense. I will be speaking rather fast, but you will be able to obtain the slide deck later and the YouTube videos. Okay. So the key messages I want to put across today is that data analytics is already showing itself to have a major impact on the global commercial supply chain, but it's not really being used in the public sector. It has the potential to have a huge impact and really transform everything we do. But in the public health sector, it is little recognized. We've got little data available. What data we have is often incomplete and of poor quality. There's little knowledge about the tools that are already available for data analytics. And the modern techniques are often being blocked by archaic regulatory procedures. The use for data analytics is a powerful tool, and we have to find ways to embrace it. So the learning objectives are really that to bring the message, data is key to the whole process. Without data, the value of data analytics is much reduced. So the key point to start with is how we collect the data. And a lot of that is before we can even start data analytics, we need data collection tools. We may be able to obtain the data. And that's 80% of the blockage in the public sector, obtaining that data. In contrast to the private sector, our challenge is not working with big data, it's getting any data at all to work with. We often don't know what our stock levels are. What's the value of the inventory in our warehouse? No idea. What's our fastest moving item? Don't know. What's our expiry rate? Don't know. We don't have the data. So before starting this data analytic process, we need to define exactly what we want to do. And one simple way to do that is with Excel spreadsheets. They're not going to be data analytics, but they help us set the parameters for what we want to achieve from the data analytics. So the message is start simple and build up. Don't try and jump straight in to complex data analytical tools. Further, most of the existing data analytical tools are for use in the private sector. They're not really appropriate for what we do in public health and in public sector operations. Public sector really is different, and we need slightly different tools. Administrative, regulatory, and especially financial procedures can be a major restraint on us trying to implement data analytics. So we have to understand the role of advocacy to obtain data, and advocacy to overcome archaic process to allow us to use data analytics. Finally, we have to recognize the role of training and knowledge. Almost no one has been trained in data analytics. It's a new topic. Although it's been in use for a long time, the procedures that we're now using, the analysis that we're now using is all relatively new. So there is a huge demand for training and knowledge in data analytic methodologies. We start with our definition of data analytics. So it's really the practice of collecting, managing data to transform it into actionable evidence. And that's the key to data analytics. We go from data to evidence. Far too often in public sector supply chain, we're guessing, we're using experience, we're extrapolating. We don't have evidence. And we're buying at millions of dollars without evidence. No one in the private sector would ever consider that. But we have to look at using data and analytics to bring forward this actionable evidence, evidence that allows us to take informed decisions. And that's the key to data analytics. It's long overdue. We need it. We have to be able to drive it. There are tools for the public sector. UNICEF has tools for data analytics in the public sector and other agencies as well. I'll be talking about those a little bit later. But for now, let's understand the key to data analytics is transferring data into actionable evidence. That's what we want. hard evidence to make management decisions. Well, the key problem and the biggest problem in the public sector is we don't have data. And in many countries, there are no processes by which we're ever going to get the data. It's not there. Information doesn't get fed back. It doesn't come up in the chain. We get partial reporting on archaic paper-driven systems. And even when we get the data in paper tools, it's often locked into silos. So the financial information is kept in the Ministry of Finance. We don't get to see it. Other information, the medical information, is kept in the health records. We don't get to see it. This is the siloed information. If we're to use data analytics, we have to be able to have access to the data. We must recognize that right now, in the public health supply chain, we don't have that data. Just as an extreme example, only 25% of countries could say what information they had. They had no information on the stock out rate, days out of stock, the expiry rate, the damaged good rate, the stock value, none of that. Even in the middle of this major epidemic, we don't have data. We don't have information. That's how extreme the problem is in the public sector. Why don't we have the data? Well, top of the list is we don't have the core competences and skills in data management. That has to be built in. Many of the supply chain staff are pharmacists. They've not been trained in data management. We require personnel equipped with a range of skills to be able to undertake business analysis, process improvement, enterprise development, software implementation. Those are all new skills. Finally, the private sector is also trying to recruit people for data analytics. So we're in competition with them, and they pay much higher salaries than the public sector does. So it's difficult to get staff, it's difficult to train staff and to retain them when they've been trained. Why is it so important now that we do data analytics? Data analytics has been a prime subject for 10 years. Why is it of such paramount importance now? Well, because of COVID. COVID really brought home to us how fragile and how weak the supply chain is. It is for certain there will be another epidemic in the future. We have to be much better prepared. We cannot be in that same situation of we don't know. We have to have the information available, and that requires implementing data analytics. Data analytics, why is it so important in the supply chain? Because supply chain should generate big data. It should generate lots of issues, receipts, usage patterns, but we're not collecting that data and we're not analyzing it. If we can have much better control, and we bring major cost savings to the whole operation of the supply chain. Okay. Well, how can we possibly do data analytics if we don't have any data? There are really two approaches. One is to say, I can't do it, so we'll just leave it. We'll just have to carry on as we are. And the other is to understand that we can do data analytics without big data. It's a lot better with big data, but we can get started on what I'm going to call little data. You don't need a complete data warehouse to start data analytics. We can use little data to get started. And I'm going to give a few examples of that next. Firstly, we must advocate for the role of data analytics, that it's recognized. Then we start with, I go to 20 clinics, see what the stock levels, see what the usage patterns are. I can also use proxy data. That's data from similar systems, maybe data from other regions, from other countries, which are similar to my own, and then use mathematical models and algorithms to model how it might be in my country and in my operation. Finally, I seek to bring system strengthening, to improve my data analytics, to instill, scale, and sustain data analytical operations. So I start with advocacy, I look at little data, I continue the advocacy, and I think about technological leapfrogging. If I'm to convince a nurse to fill in a stock report, that's never easy. If I can try and do it on a mobile smartphone and send a report once a week, that's sexy, that's interesting. I might be able to do it. Instead of counting boxes, if I can use barcodes and scans and other electronic information, again, I have a better chance to capture data. So I can look at all of these roles of working with little data, of starting to collect data and starting to do data analytics with little data. First tool I need for data analytics is advocacy. To advocate for data, for collecting data, to understand how important data is. What is the value of data and how it's worthwhile to invest in data collection. And on the right, you can see the different steps in advocating for digital infrastructure, data quality through training, because even when I get data, it's often incomplete and poor quality. Interoperable systems, data for action, not just reporting. So when people report, they get the results back. Data analytics provides them with a report. Policy changes to allow me to use data analytics. And there's the link to the Public Health Advocacy Portal, which will give you more information on advocacy tools. So advocating for data requires integration. I have to be able to get information about all of my products, all of my information. That means the finance. Often I don't know the cost because it's done on an annual tender. That's held in the Ministry of Finance. What's the cost of my products? Don't know. I'm into estimates. I have to have access to the data and increased data visibility across the entire operation. And that means coming into conflict with medical ethics of accessing medical records. It has to be aggregated data. We have to observe patient confidentiality in obtaining that for usage patterns, but it can be done. Data analytics has established procedures for allowing that. So this little data survey, this is an example from Jos in Nigeria. Go and survey some health centers, see what the information is, collect the data. Once I got that data, I can then put that into my data analytics and start processing. Yes, it's not very good, but it's a start. It will get my data analytics skills developing and moving along, and I advocate to collect more data in the future. Can also look at using proxy data. When the COVID pandemic started, there was no data. No one had COVID before. How can we do data analytics when there's no data on this disease? So we had to use proxy data. We used data from the World Bank on populations and healthcare parameters, and we formulated using similar disease patterns, SARS and avian influenza, and formed a model, algorithms based on the models of SARS and avian influenza, and then used Delphic expert teams to develop those algorithms to put forward forecasting models. So many of you may be familiar now with the WHO essential forecasting tools for COVID commodities. The first issues were based on SARS and avian influenza. How many masks? How much medicine? How many gowns, gloves do I need for all of this? That was calculated using proxy data. As the pandemic progressed, we obtained real data and modified the model, modified the system until the stage where data analytics could actually dictate to us what the parameters were for the operation of forecasting the future, predictive data analytics. That came forward. Did it work? Well, yes, it wasn't so bad. It was useful for early signals to the market of how much we would need because it was massive. And it did a reasonable job of forecasting, and it got better over time. And that's the key message. If we can get started in data analytics on little data, we can collect more data and improve as we go along. And it certainly did. The model got much better as it went along. So using proxy data can work. Leapfrogging using technology, basically collecting using electronic formats. Smartphones in those countries where they are available and can be used, where there is a mobile phone network that works, tracking, using barcode scanners, all of that to help leapfrog into data collection. Instead of trying to modify our archaic paper-based systems, try to leapfrog the technology going forward. So my key message from this first section is data, data, and data. Advocate for data collection. Don't accept, well, we've always done it that way. We need to change the way we collect data. Try to use the new technology to improve data collection and use tools to help collect data and improve data quality. Okay, we're now into a 5-minute Q&A. Let's see what we have in the Q&A box. Gabrielle, do you want to pick some questions from the Q&A box? I'll try and answer them.
Yes. So I will thank you, first of all, for your very comprehensive part one for this session. As we wait for some questions to start coming in the chat room, I will prompt you initially with one question that I had myself. So we have talked a lot about, the importance of data and the lack of it, and especially how this has become a pain point, and the lessons from the COVID-19 pandemic as to how this is something that really needs to be focused on moving forward to have data-driven decision making. So thank you for this. My first question for you, while we wait for some of the participants to ask their questions, would be, we talk a lot about the nexus of new technology and supporting this data aggregation. If maybe you could expand a bit on the role of artificial intelligence and how this, from your knowledge, could help or maybe even complicate some of these procedures in aggregating little data. How do we graduate from this step into a more comprehensive approach?
Okay, right now I would say AI is excellent for big data. It's not so good for small data. Because we have a limited data capture, it's easy to extrapolate to the extreme from a small amount of data. So AI is not particularly useful in the earlier stages. As we develop, we get big data, AI comes into its own. It can really help identify predictive patterns that we didn't know were there. A simple example is we often get seasonal patterns. So in malaria use, it's seasonal in different countries at different times of the year. That's hard to identify on small data sets. On large data sets, that becomes apparent, and AI can flag that up to us. On small data sets, it's not usually that clear and that apparent that we have that. So AI, yes, comes into its own on the big data, not so useful when we're getting started in the earlier stages. We need big data sets for AI to work properly.
Thank you for that answer. That is exactly what I would have expected. Now we're still waiting for some questions to come in the chat room. So I have another question for you while we wait. And if we don't have any questions after this, then we will proceed to your part two. My second question would be specifically about collecting and aggregating little data and proxy data. If there were any examples or case studies that you can give as to how this was achieved, something more tangible that we can refer to, because this is a very important aspect into bridging the gap in the data technical divide.
Okay, I think every time we introduce a new medicine, we're going to have to use proxy data because we don't have any experience with it. So introduce a new TB formulation. How is that going to work? what's the uptake going to be? And usually these have already been trialed in the high-income countries. So we have to take proxy data from the high-income countries and use that as an indication of the low-income countries. It's not good, but it's the best we've got, and it gets us started in the system. So particularly with HIV, new formulations come along and they're always released in the high-income countries first. And we get the data from there as a proxy for what it might be in my country. That's certainly on the proxy. Little data by survey. If you can't get reports in, you go and survey. You don't have to survey more than 10, 20%. That will give you the indication. Even if you only do 20% of the commodities in provincial or regional warehouses, that helps. What is the real usage pattern? How much is used, how much is wasted? Go to the clinics, go to the hospitals, survey and find out. I then get useful wastage information, which formulates my calculations. UNICEF collects wastage rates on vaccines. It's one of the very few organizations that collects wastage rates. So they know that from their collection system. We can use those tools and extrapolate from that area to see how much wastage I'm getting in other areas.
Thank you very much for that answer.
Okay.
Very comprehensive. I see we have some questions here from the chat, so I will proceed with a couple of them before we move on.
Okay.
From Chetan Sharma, which open source data collection / management platform is best for healthcare settings?
Best is a difficult term. The ones you can use, we're coming to very soon. I'm going to talk about open LMIS systems. We're coming to the tools. We'll talk them through in just a few slides' time.
Okay, very good. That's what I imagine. Another question from Ngoa Swokka Jirese. How do we advocate for data in a system which is intolerant to data collection? Perhaps as well with some mention on ethics for data collection.
Yes, it's difficult. You have to learn advocacy skills. There are UN guidelines, there are UN training programs in how to advocate, and we have to do that. And in the past, it was we could engage with other actors like NGOs and donors to activate. With the donor community now being at such reduced circumstances, that's more difficult. But we can use NGOs and the FBOs to increase our advocacy. Sometimes our own ministry, our own organizations won't listen to us, but they will listen to outside players a little bit more. And trying to engage them so you are not alone. Engaging the UN agencies is key. UNICEF is excellent at advocating. Yes, so is UNDP. They will advocate on your behalf to put that through. So don't think you have to do it alone. Bring the partners on board, because often ministers, governments will listen more to the partners than they will to their own people, their own staff in the system.
Perfect. Thank you very much for that answer. So I see here we are receiving some more questions. However, we're going to proceed now to part 2 because a lot of these questions are related to common data analytics tools to use in public health. So I believe that we are best proceeding forward with the second part of your presentation. Thank you once again for this first part, and I encourage everyone to continue asking questions throughout the remainder of the presentation so that we have them ready for the second Q&A session. Thank you.
Okay, here we go. Let me see if I can get this to work now. Okay. Right, so I've talked about data being restricted, but it's not just data. It's even the concepts of data analytics, which frankly have been ridiculed by the public sector. So a widely used model in the commercial sector is the economic order quantity and the economic order interval. In effect, is it better for me to order a little bit often, or should I order a lot at one time? Which is most economically advantageous to me? And this can be calculated using a formula called the EOQ. It's very common, it's used throughout the commercial sector. But in the public sector, it's ridiculed. It's used, the formula uses a square root system, and they say, well, we don't know what the annual usage is, so that's a guess. We don't know what the storage cost is, so that's a guess. We don't know what the acquisition cost is, so that's a guess. So it's a guess, a square root of a guess divided by a guess multiplied by a guess. So it's useless because we haven't got any data. So we've found data analytic techniques being dismissed as not appropriate to the public sector. And we have to advocate for data analytics. We also have to understand that supply chain in low-income countries doesn't have a good reputation. But part of that is because it's not allowed to perform. It's tied to archaic and obsolete methods, particularly around procurement. If I calculate the economic order quantity and the economic order interval to be 3 months, I'll be told, no, we only buy an annual tender. Why do you only buy an annual tender? Because we've always done that for the last 50 years. And many of these rules and these archaic administrative and regulatory procedures were part of the colonial heritage more than 50 years ago. We're still using them. We have to be able to challenge that and say, evidence-based decision-making, no longer are we having this decision by administrative convenience. It has to be evidence-based decision-making on what's best for the operation, not what's best for administrative convenience on annual tenders. Tenders are still useful technique, but they can be managed in different ways to allow us the flexibility of different order quantities and times. Data analytics has been shown, even in the public sector, to bring savings of around 20% in cost operation. That's a massive saving. 20% more medicines we could buy, 20% more health commodities we could buy if we were able to lever data analytics. But we're not using them. Hospitals are not using them. We're not implementing them because they're not regarded as being practical for the public sector. And our failure to embrace data analytics is holding us back. Our supply chain in the public sector is not improving. Private sector is leaping forward in supply chain, and we're not. We're not getting better because we're not introducing data collection and data analytics. Okay. What are the tools for data analytics? Well, there are specialized software platforms like GHX and Health Catalyst, and also OpenLMIS, which integrate complete systems for data collection and data analysis. There are also general purpose tools such as Power BI for creating your own custom dashboards, and of course, IoT data. There's also artificial intelligence and machine learning tools that can help to identify complex patterns and undertake predictive forecasting. But many of these tools have been developed for the commercial private sector. They're not all that much use for the public sector operation. And while the tools are listed on the screen with links there, okay, GHX, SIFT Synergy, and others, they're not really that good for public sector operations. And that can be extreme. If we look at the survey of the 15 best healthcare supply chain softwares, 15 best in the world, only one even mentions public health, and that's EM Supply. And that says, well, it's really just for emergencies. It's not that good for day-to-day operations. So how am I going to be able to work with this when all the software is for commercial operations? GHX, we can see, if we look at the list of companies using it, they're all in the USA. They're all private sector operations. It's an excellent piece of software, but it really is focused on the private sector. It does very good data analysis, does very good data collection, but only in the private sector. Another company, strangely called Geeky Ants, they can help you develop your software, but again, it's nearly all focused on private sector operations. It can help you collect that data and make data evidence-based decisions. But in the private sector, that's not really what you're doing. So what are the public sector options available to you? First, the UNICEF tools. UNICEF has a suite of tools available from the system digitization portal all the way through. Links are on the screen. Go to the UNICEF site, look at the different tools that are available. You don't have to have a complete operational system. You can choose a partial system, get that operational, and then seek to develop on it from there. There's also the ScanIt UNICEF tool. That's analysis, supply chain analysis, and an intelligence tool, ScanIt. That uses data to provide alternatives, which is the better function. Is it better to have one central warehouse or 5 provincial ones? Does these what-if scenarios, very good at doing that. Also good for visual analysis, providing clear plots, clear images of the data, so it's in a usable, easy to understand form. OpenLMIS is developing more data analytical tools. It's been around for quite a while, and it didn't have much data analysis, but now it does, and it's developing more regularly. So OpenLMIS is a powerful source. It's open source. It's cloud-based information system. It works really well. It's worth considering LMIS. DHIS2 for logistics and supply chain also works well. Very good for stock management, very good and increasingly for data analysis. Examples are on the screen. Tools there available. Worth looking at again. DHIS2 often linking with other software. Together, mSupply linked with DHIS2 is a powerful combination. mSupply, I've just mentioned, also managing and increasingly coming with data analysis. Very good dashboards, visual displays of the information, helping you to make decisions. Okay. It's the most used logistics management information system in low and middle income countries. We're thinking about mSupply, we're thinking about that because all of these LMIS systems for the public sector are developing increasing data analytics. It's built in. So as you're collecting the data, the analysis is built into the overall operating system of the LMIS. You don't have to do a complete operational system. You can just do a little bit. These are from GH Supply, stock redistribution tool, using data analysis to help you find, is it better to redistribute stock or should you leave it in place? Okay, I think that's a good tool, works well. It's a good example, good graphics. You can see the plots on the screen of the distribution. Good graphics to help planning, helps data decision making, a good example to get started on data analytics. Most of you will have the data and the locations considered for redistribution. So how do we go about this data analytics? Well, we start with advocacy, examples, and move into scale. We have to advocate and advocate and advocate and really push for data collection, for data analytics to be adopted. It's not easy, it's a hard battle. As I've said, you're not alone. The UN agencies, among others, will support you in advocating for that. So my overall summary is data management and data analytics is a critical requirement. We can't just keep guessing. We have to have some evidence-based information. It's a major restraining factor in improving our health systems, improving our supply chain. And if we don't, how are we going to respond to the next pandemic? We have to get better. Our staff need to have the skills in data management and data analytics. Training courses are available for these skills with Empower School of Management and UNITAR. We have the postgraduate diploma in data management and public health procurement and supply. List of the courses is there. You can find the full information on the Empower UNITAR websites. The postgraduate diploma in digital health, similar again, more details around that, ethical considerations, policy and governance, everything is included there in the course. It's online courses. And then the overall suite of courses with UNITAR Empower. Okay, I've rushed through that to try and give us some time for Q&A, because I think there'll be more Q&A around this section.
Yes, indeed. Thank you very much for this second part of your presentation, Professor Barraclough. So I already see that we have some questions more specifically related to this, so I will start right away. So we have one question from Ahmed Tijani. His question is, could we use data analytics tools for public finance for children, or are there any available tools more specifically for this?
For health care for children, for health issues for children, yes, of course. Yes, you can. Data analytics are there. UNICEF, of course, is the agency for children. They have the data analytics tools on their website. You can see there, especially for vaccines, but also for nutrition and other support to children there. Yes, it is there, but we start with data collection. Then we can do the data analytics for children. Yes, they are available.
And building off of this as well, there was a question from Shamisange Rosine. Are the tools for public sector health supply chain that you mentioned, do they integrate supply chain and finance, or is it just one or the other?
It depends what you mean by finance, but yes, they have financial modules, they have financial inputs. The difficulty around that is often the Ministry of Finance has their own unique computer system, and that doesn't always integrate well with anyone else, because often they are archaic systems and it's difficult to connect with them. But yes, they do. They have modules which include financial operations.
Okay. And a question from Tasu Legese. Which data analysis tools are recommended for developing countries for private and governmental sectors? I know that you gave a quick overview, if you maybe want to highlight some specific examples.
I think OpenLMIS is excellent. That's very good. MSupply is also good. DHS2 is also very good. All of them are fine, but the message is before you look at that, you have to define what you want to achieve, what you want to do. Be sure of your outcome. Mm-hmm. And you just mentioned finance. Integration with finance is a key one. And being able to achieve that will limit the tools that you might be able to use. So a clear definition of what you want to achieve, perhaps just use some Excel sheets to give you some idea of where you want to go and what the options are to start with.
Thank you. I will say I encourage everyone to, if they have any more questions that they would like to ask, to please write them now. I will proceed with two more questions unless we receive any more. This is a question from Nasir Ahmad Falaki. How does data quality impact supply chain performance?
It's a direct impact. We use the GIGO principle, garbage in, garbage out. If you've got poor quality data, your forecasts are inaccurate, sometimes widely inaccurate. If you're 20% out in your forecast for a middle-sized population country, let's say 20 million, that probably equates to around $10 million off in your forecast, either over-ordered and wasted or under-ordered and people are dying because you haven't got the medicines. Mm-hmm. So just 20%, and frankly, few public sector systems have data quality at 80%. So that 20% error in my data quality has a huge impact on my predictions and my operations. I end up with wastage, not because my storage and warehouse operation is poor, but because my data quality is poor. I'm ordering too much because I'm getting the wrong messages from the data, because the data is incomplete and inaccurate.
Thank you very much. And I think this is as well very important to remember, considering your earlier point on knowing exactly what it is that we need and what we are looking for from the data. So making sure that the data quality reinforces this. I will end with one more question. It's a bit more specific from Antonio Langa. Considering Mozambique's large-scale data environment, how can AI be strategically applied to enhancing forecasting, strengthen early warning systems, and improve overall supply chain performance? So we spoke a little bit about this with the earlier Q&A, but if you have any more comments you would like to share regarding this.
Okay. With that volume of transactions, AI can play a role. You've got a big enough data set. The problem around that is, what's the quality of that data set? If it's good quality data, AI can identify, predict patterns, usage patterns, which you may not be able to do by eye, which you'll not be able to do by human mind. So perhaps one drug is being used less and another drug is being used more. It's not immediately obvious. Seasonality, of course, malaria is a common one, but seasonality applies to lots of medicines, and it's not immediately obvious that it applies. Local conditions can affect that. As we are seeing climate change, we're seeing increased temperature problems and flooding. That will also impact. AI can help to identify those at an earlier stage. I'm seeing more flooding, I need more emergency relief, bringing that forward, which again, I might not normally do by human mind alone. So yes, AI can be very beneficial on large data sets, but only if it's good data quality. AI can be used on the analysis, on predictive modeling, and there are AI softwares available to help you do that.
Thank you very much for that comprehensive answer. I see here in the chat and in the Q&A section that I believe we have no more questions. Professor Barraclough, if I may ask you to just return to your previous slide, where you have the list of the programs offered by UNITAR and Empower School of Health. I will use this opportunity to launch our second poll that we have. And I will again actively encourage all of the participants still connected to please participate in this poll. This is for us to help understand your experience as well as your interests regarding the data-driven decision-making in supply chains for health and in procurement. I will also talk now a bit about the courses that we offer between UNITAR and Empower School of Health. So as you can see here on your screen, there is a mix of programs both at the postgraduate diploma level as well as the master's level. The master's programs are offered in modalities of either 24 or 12 months, depending on whether participants have already completed a previous postgraduate diploma. So we have Master of Science in Global Health, Procurement and Supply Chain Management, a postgraduate diploma in Pharmaceutical Management, a postgraduate diploma in Digital Health, an online postgraduate diploma in a Global Health, Procurement and Supply Chain Management, as well as one in Data Management in Public Health, Procurement and Supply Chain. So please use this time to fill out the poll. And I would also like to reiterate that for all of the participants who would like to receive the slides, we will communicate all of the relevant content and material with you at the conclusion of the webinar. So thank you for participating in the poll. I will let it run for 20 to 30 more seconds. We have a very even mix of representatives from ministries of health, government agencies, as well as public health organizations and NGOs. There is a very specific interest for digital health and data integration. So thank you once again, Professor Barraclough, for this presentation regarding specifically tools that can be used. And we will use all of this information as well moving forward as we continue to create more webinars between UNITAR and Empower School of Health. So thank you very much. I will run the poll for about 20 more seconds, and then if there are any outstanding questions that anyone would like to write or to ask before we disconnect, I encourage you to do so now. I have one more question for you, Professor Barraclough, before we conclude. This is
Excellent.
from Godfrey Kingalu. Which analytics tools can integrate with data from multiple sources to provide a unified view of health commodities available? So DHIS2, ERP/SAP, is there a tool that combines all of these things?
I don't know of one. DHS can work with M Supply. That's the only linkage that I know of that works together well.
Okay, thank you very much.
You really have to select one that you're going to follow through.
Mhm. So I see here, I think that that was the last question that we received. So I would like to thank you once again for this comprehensive presentation on data analytics tools. Thank you very much. And for all of the participants that were connected today, we thank you for your participation and for connecting. And we will hopefully see you very shortly and very soon as well for our next webinar.
Okay, many thanks.
Thank you very much. Have a pleasant day. Bye-bye.